Thank you, Mr. Chairman. We've just been talking about costs. One cost is labour cost, and if people go into hospital, so they're concerned about their health, so they don't worry too much about the labour cost. But the government, as I understand it, has brought in a ruling about subcontractors' costs. But it's very easy when you're trying to run a lean ship to get rid of your experts, and then you find on a Saturday or something or a Sunday you're short of the experts. So what do? You have to hire them in. And it is an immense cost. I came across it years ago when I found doctors were working 24 hours and billing for 24 hours as relief doctors. Massive amounts of money. So my question is, how do you deal with this? How do you stop wasting public funds because you've badly managed? It's an area that is nobody really notices it, and you can run it very badly, but it costs a huge amount of money, and as we know, we've overspent on the NHS. Thank you.
Yeah, and so we're not the Clinical Commission Group we're not a supplier of services. So we typically have a £500 million that we deploy to buy healthcare for the citizens of Fair and Gospel. But we work very closely with the suppliers of healthcare, for Southern Health and other suppliers, to be really vigilant, because, as you say, bad workforce management drives quality problems, safety issues, and high cost base. So dreadful if you don't plan your workforce well. You have to go out to get a locum or a temporary agency staff who don't know the ward, don't know the process, expose patients to high risk and inefficient utilisation. Really pleased to say that I think this year, Portsmouth Hospitals Trust, as an example, have worked very hard to address the high use of locum and agency staff. So they've gone out, they've recruited heavily. They've gone to Spain, Portugal. They've to address some of the vacancies, as well as locally within the local labour market, to avoid just that around the nursing staff. And on their medical staff, I think they've been successful, certainly in a number of specialties, ED medicine, medicine for other people's services, urology, to be recruiting permanent, high calibre staff. I think probably the area that is being felt most viscerally, but I think is probably less hidden, is around general practice, where, I'll say it for David, GP income goes down year on year on year as a partner, because if you can't recruit, you have to take a hit in your pay in order to pay a locum significantly more than you in order to see the patients that you see. So I think there are, if you can get a locum, so there are lots of doctors working in that model who are billing large sums of money, and the highest paid doctors at the moment in the NHS are probably your locum and your temporary doctor.
Thank you, Richard.